Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek De Silva. As kids head back to school for the new year, many will be playing sports. A growing problem parents need to be aware of is a hidden heart defect called hypertrophic cardiomyopathy, which is the leading cause of death in people under the age of 30, including many athletes. Here is Dr. John Gallucci, physical therapist and founder of JAG Physical Therapy. He helped St. Barnabas Healthcare System cardiac screening program for athletes with over 2,000 tested so far. Welcome back to the program.
Thank you so much, Doctor. I appreciate it.
So let's start off with, what is hypertrophic cardiomyopathy?
Well, it's a basically an anomaly of the heart that you get a thickening of the wall. A thickening of the wall of the heart stops the blood flow and can cause a sudden death when you increase the blood pressure through sport or increase pulse rates. The flow doesn't stop, and a young athlete can fall into cardiac arrest.
Now, why is this so hard to detect?
Well, it is something that is hereditary, that people do have in their family lines. And basically what happens is a normal physical sometimes does not include a true listening of heart sounds, a blood pressure, an EKG. So what we've done over at St. Barnabas with the Morahan Center, is the Athletic Assessment Center, is basically implemented a program that has pediatric cardiologists doing EKGs, listening to heart sounds, and making sure that children, before they go to sport, do not have the prevalence of this hypertrophic cardiomyopathy. We've done it at all levels of athletics, including major sports, so why shouldn't we do it for our children?
Absolutely, and it probably should be done for your children, because this is something that you want to pick up early. Is it, I mean, we're hearing about this more and more. Is it because of screenings? Or I mean, it probably makes sense because it is because of screenings, right?
Well, it is because...
And a lot of these kids are, unfortunately, some of these kids are dying, and we need to be aware of this.
You know, if we look in the last several years, we've got an incidence of about 1 in 200,000 deaths, one person in 200,000 that have been detected, and we've had some deaths. Here in New Jersey, we've had close to 3 deaths in the last 5 years that have been caused by this disease. In New Jersey, we've been very fortunate. We have a very proactive government that is now educating, the Department of Education is educating the schools, educating the parents, and now pushing towards screening.
These young people be screened. Do you have is there a number?
The American Heart Association and the American Pediatric Cardiac Association. Yes.
So at the age of 6, if you've got a child that's going to be playing sports, and they usually start when they're 10 or 12, they should be screened first. Is that what you're saying?
Well, you know, when we say 10 or 12, I have a 6-year-old that's pretty active in soccer and basketball. You know, it's Bumblebee soccer, but he's being tested on October 1st. And it's very, very important that you usually pick up the detection.
Wow.
Yeah.
Amazing. Symptoms, typically what do we see?
You know, usually you see it's a quick onset. You'll see shortness of breath, palpitation, you'll have some chest pain, similar with any type of cardiac incident. But the problem is the onset is very rapid and quick. And that's why we're recommending that schools teach their coaches and their parents CPR, have AEDs readily available. If you look at our statistics, 1 in 200,000, we have over 6.6 million people in high school sports. If we take our health, we need to get people tested to save lives.
That's a lot of people. Walk me through the typical testing. You said an EKG, which is the you know, where the leads are on the chest. Typically, what do you see on that? Is the enlargement of the heart?
Yes, usually through the research we've learned, and the Italians actually in Italy have done a tremendous amount of this research because they actually have made it a standardization to perform athletics. But here in the United States, through the research, we found that a good medical history of the parents and ancestors, a very, very good comprehensive exam from a pediatric cardiologist, and an EKG will detect the anomaly. Cardiologist will say the athlete can or cannot perform in an athletic event. So that's
let's say you find this in a young person, 10, 11, 12 years old. What do we do?
Well, you know, again, the concept is you can't play sports. You know, it's something that needs to be monitored. You know, there are some physicians that are saying that there's some surgery, research in this, but basically most pediatric cardiologists are recommending that the athlete do not perform.
Do we know why? Do we know why this develops?
It's just an anomaly. That's a hereditary anomaly that's developed in the heart.
So it's a genetic
thing
yes. that really nothing can be done about.
Correct.
Wow, that's amazing. So your screening program, very quickly, talk to us
Our
about
screening
that.
program over the Morahan Center is basically mimic off of a lot of pro athletes, which is a program out of the Morahan Center that the athletes come in. They're evaluated by a cardiologist after they review the questionnaire, and then the EKG. I'm also the medical coordinator of Major League Soccer, and we've had the opportunity to screen our athletes, and we've basically been able to find an athlete that got through our youth system, Zach Harold, and now he can't play professional sports because it was never detected, and he could have just passed away on the field, and luckily his life is saved.
Wonderful. Thank you very much for joining us. Pleasure to have you back with us again.
Greatly appreciate it. Thank you.